In this video, we'll go over a case where we do what I like to call an invisible veneer or a labial veneer. And so what we do is we give the tooth the strength that it needs without covering it with a veneer. So this patient is in her very early 20s and has these two lesions on the apical of 8 and 9. So she needs root canals. You can see from the photo that she has these composite fillings that are constantly chipping. She says she has to get them replaced about every year or so. They're always chipping. And so we have a tooth that's fairly compromised, and we're giving it a root canal. So we're in a place as clinicians where we don't want to give someone this young two front crowns or two front veneers because they're not going to match, because she's too young to get them, right? Her gum tissue is still going to move up. And she has beautiful teeth, right? Like, they're not perfect, but we don't want to give her anything that's going to stick out. Even if we use the nicest lab, first of all, the lab fee is $850 a tooth. So this young person's going to have to pay for that. And they're still not going to perfectly match. And she's so young that the color of her teeth are going to change fairly significantly in the next couple of years. So it's never going to be a very good long-term solution. So this technique bridges that gap where we're kind of on the edge of, do we just do a filling? Do we need to do a veneer? But we don't fully love the idea of doing a veneer or a crown. And so this gives us the strength that we want without changing the color of the tooth. And so if you've seen our video in the past of how to blend a porcelain margin, this is the same principle. So we've done the root canal, and now what we do is a veneer only on the lingual surface. And so now when she bites, she's only going to be biting on the porcelain, and the porcelain is bonded, so it's going to distribute the forces evenly. And then on the incisal edge where it meets, we blend it with our hybrid layer. And so we have the shade of her tooth, and we go much more translucent than it should be. And then when we blend that in, we're just using composite to be able to get that invisible margin so she can keep her natural tooth color while still having the strength of an indirect restoration. Once we seat this case, I'll show you the final results, and you'll see how her teeth looked completely untouched. Her teeth look completely natural. Those composites on the incisal are now not going to chip, and she gets all of the advantages of having a crown or a veneer strength-wise without any of the drawback.